All right, guys, so this is part 2 of chapter 5. So we're going to start with letter G, the shapes and types of bone that we have. So you can see that we have different categories for different shapes of bones. Sutural bones are kind of a strange thing. Not everybody has a sutural bone. It's what forms inside of a suture, and this is variable between people. Sutures, by the way, are these lines that you only find in the skull. They join two bones together. It's a joint. But sometimes these extra bones develop. So that's a sutural bone. Number 2, pneumatized bone. Pneumatized bone has air pockets inside of it. This example is the ethmoid bone. We'll talk about in chapter 6 bones of the skull that have air spaces or pockets in them. Sometimes they're called sinuses. So the ethmoid bone has air pockets. The pneumatized, to help you remember, pneumonia, right? This looks like pneumonia, and your lungs have pneumonia, your lungs have air sacs in them. Your lungs don't have pneumonia right now, hopefully. Number 3, short bones are just short and cube shaped. So they are going to be kind of like a cube, the same estimated width, length, and height. And you find most of your short bones in the wrist. And also you have some short bones in your ankle. Irregular bones are just a category that doesn't fit any other shape. Your vertebra is a good example of an irregular bone because it's kind of a complex shape with different ridges and different projections. Flat bones are flat. They don't have to be straight flat. They can be curved to them. So the bones of your cranium are flat bones. Your ribs are flat bones. You can see I made red the different flat bones you have. The roof of your skull, the sternum, the ribs, the scapula. The next topic is long bone. Well, let me move to sesamoid bone and then long bones, because long bones, there's a description. Sesamoid bones are bones that are usually small and round and flat, but they form within a tendon. So your sesamoid bone, the biggest one is the patella. The patella is your kneecap. Some other people have bones, few individuals have sesamoid bones at every possible location, but some, I'm just reading this here. Some of them have them in your hands and feet, but this can be variable. They develop inside tendons. That's your big definition here. All right, so let's look at a long bone. So for long bones, there's a list of different features of long bone that I want you guys to know, and I'm going to scroll back to that long bone image that we had here and move through. So epiphysis, diaphysis, and metaphysis, A, B, and C, are just the regions of your bone. So the epiphysis is going to be the tips of a long bone. Okay, epiphyses are here. Your diaphysis is going to be the shaft, and so it's going to be the middle part of your long bone. Then there's a little space between the tip and the shaft, and that's called the metaphysis. Okay, so you can see the metaphysis is labeled here in this region, kind of like the neck between the tip or the very ends and that long, narrow diaphysis. So those three are just regions of a long bone. Then we have medullary cavity with yellow marrow. So I pointed that out earlier. Oops, sorry. I'm trying to change color pen and it's not letting me do that. Okay, so the medullary cavity we talked about earlier with being a space within a long bone filled with yellow marrow. And again, you should know yellow marrow is fat, okay? Yellow marrow is a storage place for fat, adipose. Then articular cartilage, letter E. Articular cartilage is cartilage that you see at the tips of your long bones to protect them, because your long bones will all make a joint with another bone. So the articular cartilage is found on the tips. So you can see the articular cartilage here. You can see it's colored by light blue. And by the way, light blue is the color they use for cartilage throughout the book, if you haven't noticed yet. And notice that the cartilage is only covering partially the epiphysis, because it's only going to cover where the bone makes that articulation or joint. So if you're wondering where the word articular came from, articulation is a joint. So articular cartilage is cartilage that protects the joint. Letter F, epiphyseal plate. I'm going to pause. I'm not going to cover that here. I'll just show you that there's something called the epiphyseal, where is it here? They do say epiphyseal line. I'll explain that in a second. The periosteum and Sharpie's fibers. So the periosteum, remember, is that membrane outside of our bone. It's held on to the bone itself with Sharpie's fibers. Okay. Periosteum ends where the articular cartilage begins. So the periosteum covers the entire bone except where there is articular cartilage. The next one is H, compact bone and spongy bone. You guys already know this. Compact bone is on the edges of all your bones. So every single bone will have compact bone. And then inside, every single bone will have a layer of spongy bone, or otherwise known as cancellous bone or trabecular bone. And in these regions, you'll have red marrow. So in the spongy bone, right, you're going to find in a living bone red marrow, and this is your blood formation. This is hematopoiesis, where blood is made. Okay, so those are the regions of your bone, of a long bone. And we're going to now turn to growth and remodeling. So I'm going to flip over to growth and remodeling. So first question for you, a bone that has about the same height, length, and width is? You should answer B, short bone. And then here's our picture of some fetuses. So you should know that under this growth and remodeling, that your bones are constantly remodeling throughout life. It's not like you put up a scaffolding and there it is, it doesn't change. It's constantly in flux, dealing with whether you're putting stress on your bones, if you're getting enough calcium, what's going on with your health, your hormones. And so your bones are constantly either building or breaking down. And that's called remodeling. And because it is doing this remodeling throughout your life, you can actually replace your spongy bone every 3 to 4 years. You can replace your compact bone every 10 years. So let's look at letter B. Ossification and osteogenesis. So ossification is forming bone from another tissue or from a soft tissue, and then osteogenesis is just growing bone. So there's 2 ways that bone is created. Number 1, intramembranous ossification, and number 2, endochondral ossification. So kind of a mouthful, but what number 1 is, intramembranous, is going on in the skull. Okay. Notice that at 10 weeks, the skull is clear. What's happening here is this tissue is called mesenchymal tissue, or mesenchyme or mesenchymal tissue. This is going to turn immediately to bone. So there's no cartilage here. So this tissue just becomes bone. And the skull and the clavicle, plus your clavicle, is made in this way. The other parts of your body, every single other bone, is made by number 2, which is endochondral ossification. Okay, so endochondral ossification means that, notice the word endochondral, the chondra refers to cartilage. So that means that cartilage is laid down first, and then that cartilage ossifies to bone. What I'm going to show you is a picture of just a flow chart of how that's done. Let's ask that question later. So here's endochondral ossification. Again, chondra refers to cartilage, right? So we know that cartilage is laid down first. What kind of cartilage? Hyaline cartilage. Okay, so I know the words are tiny here. I'll blow it up a little bit. So you first have a hyaline cartilage scaffolding, right? It's small. You have chondrocytes building more cartilage. At a certain point, blood vessels will come in. So remember, cartilage is avascular, right? Avascular. Oh, my pen is super fat. So bone, however, is not. So your blood vessels are going to start to come in. And when they start to come in, they're going to ossify. So the first place where your blood vessels come in is called the primary ossification center, this word. And it's in the diaphysis, it's in the middle of the bone. And it's going to create bone from the middle out towards the side, or out towards the ends, I should say, right? So as we move on, there are secondary blood vessels that migrate into the epiphyses. So the epiphyses is a site of your secondary ossification center, okay? And we can find that bone is forming at the ends. Now, what's interesting is, what happens is that when the baby is born, or when you were born, we have so bone is forming up in both directions from the diaphysis. It's forming in both directions from the epiphysis, but there's going to be a plate in the middle here, right, where it's still cartilage when you're born. That is called your epiphyseal plate or your growth plate. I think people call it your growth plate, but in anatomy, I want you guys to use the term epiphyseal plate. This is a plate of cartilage. Now, if you look at letter C in your epiphyseal plate, it's a band of hyaline cartilage within the epiphyses of bone. Bone can still grow in length as long as there's a plate, because remember, your endochondral bones are basing their growth on cartilage first, cartilage that then turns to bone. So you need cartilage laid down first. So if you want to grow taller, your epiphyseal plate needs to grow, it needs to expand, okay? It needs to push up to add more cartilage, and then that cartilage can turn to bone. So cartilage is organized for quick, efficient growth. Chondroblasts, right? That word chondro refers to cartilage. Blast is to bud or to form. So chondroblasts are at the top, and they're going to divide very quickly. So they're going to push the bone up as they grow more cartilage. And then, as your bone ossifies, the ossification will then follow, right? So your bone formation will follow the cartilage. So basically it pushes the epiphyses up, away from the diaphysis and in both directions, right? This one's doing the same thing. So your bones get longer with epiphyseal growth. To read from your outline, number 2, bones lengthen entirely by growth of the epiphyseal plates, and the plate maintains a constant thickness as you're growing. Now, you don't grow taller your whole life. At some point, you stop growing taller. And then what happens then is that the cartilage no longer starts to form. And this is a hormonal trigger, right? So you go through puberty, you have all kinds of hormone changes, and then the time at which you grow, your height stops is dependent on your age. It depends on your sex, if you're male or female. There's different factors here, but you will stop. And what happens is your cartilage cells, those chondroblasts, stop building more cartilage. Then the ossification continues on, and then it completely ossifies that epiphyseal plate. So when that plate becomes pure bone, that's called an epiphyseal line, okay? So when epiphyseal plates close, they become the epiphyseal line. It's all bone. Let me shrink this. All right, so what's cool is that you can see epiphyseal plates on x-ray. So this is an x-ray of a young child. You can see that gap within the bone, that gap being cartilage in that band, right? Here's another long bone. Here's all the long bones of their digits, right? You can see that gap, the epiphyseal plates. In the adult hand, you don't. It's completely sealed, and it's bone, I should say it's completely bone, mineralized, it's ossified. It is now an epiphyseal line. And so you can take a look at it. If you had found a skeleton, a human remains, definitely tell basically by the appearance of epiphyseal plates if there were a prepubescent child or if they were sort of after the growing stopped. Sometimes you can see these on the outside of bone. Okay, so let's go back to our questions. Flat bones of the skull develop from? The answer is B. Articular cartilages are located. Answer is A. And this one, answer is A. Okay, last one. Endochondral ossification begins with the formation of. Answer is B. All right, another kind of growth. So We know that you can grow taller for a certain amount of time when you're a child up to early adolescence, and then you stop growing taller. How about diameter? How about growing bigger, stronger, wider bones, building more mass? That's possible. That's called appositional growth. So appositional growth, I'm going to talk through it, but I will put this tutorial up on the module. It's a good tutorial. Watch it because it's way better than looking at still pictures. But what happens is you have a blood vessel that's on the outside of bone. So here's your periosteum. This is a blood vessel, right? Notice that the bone actually grows around the blood vessel. So your outer, this is the outside of bone, it's growing around that blood vessel and it totally encircles the blood vessel. Now what happened is the periosteum, remember, it has that that inner layer that's osteogenic, right? You have cells on the inner layer of that periosteum. Well, what happens is when it completely encircles that blood vessel, that inner membrane gets caught inside, and then now we call it the endosteum. And then what is in the endosteum but your osteoblasts, right? So osteoblasts will grow towards that blood vessel, laying down concentric lamellae, moving towards the blood vessel, okay, and then forming a new osteon after it's complete. So you can actually form new osteons, thicker bone in both parts, outer compact and spongy bone, with this appositional growth. Okay, so it's completely possible to do this. And what stimuli can cause appositional growth? So number 3, regulation of bone growth, mainly hormones. Hormones, your thyroid hormone, sex hormones, estrogen and progesterone. Estrogen and testosterone, and then you have other lesser hormones. But I also want to point out that like lesser hormones like calcitonin and parathyroid hormone can affect bone growth. But also know that stress can also, stress like lifting weights, putting weight on your bone, can also help grow your bone. So if you are looking out for bone health, if you don't want to become osteoporotic later on in life, you want to do weightlifting exercises, especially for women in your sort of middle age, or any age really, but especially if you're approaching middle age or older age group, you want to really keep that bone density up because of osteoporosis. So let's take a quick look at osteoporosis. Oh, one thing before we move on to osteoporosis is that your medullary cavity does get wider as you age. You can see from an infant to an adult, the medullary cavity widens, and this is due to osteoclasts resorbing that, but then you're building on the outside. So the entire diameter of your bone increases, but the medullary cavity also increases. Okay, so we're going to take a look at a few disorders to wrap up. We're going to look at achondroplasia. So achondroplasia is a disorder in not being able to grow taller. Your long bones are not, the epiphyseal plates are not functioning. And if you look at the term of this disorder, this is a disorder actually in cartilage, right? So the epiphyseal plates, the chondroblasts, they can't make more cartilage, therefore you can't make more bone to increase the length. And so people with achondroplasia are short. And this is a genetic disorder that you're born with. We also have osteomalacia here. So this is a softening of bones. This can be caused by not getting enough calcium, and that mineralization of your bones is not happening. It can happen for many reasons. Sometimes it's due to inadequate vitamin D. So remember, vitamin D deficiency, vitamin D is necessary to absorb calcium. And so if you don't have enough vitamin D, you can't absorb calcium, your bones can be soft. Or for some reason, you're just not depositing or absorbing calcium through the gut, and this could be some kind of intestinal disorder where you're not absorbing nutrients, or it can be excessive calcium leaving the bone. Either way, your bones are soft, and that's basically what osteomalacia is, and it can lead to these symptoms. Lastly, we have osteoporosis, which is loss in bone density. I do have a little blurb on osteoporosis here. You're losing bone mass And this happens mostly for older women, postmenopausal women, because estrogen, what happens with women is that, estrogen levels drop drastically after menopause, and that estrogen helps to build bone. So with the loss of estrogen comes a loss of bone mass. And we can see clearly through this is a 37-year-old male cross-section of their bone, spongy bone, and this is a 75-year-old female. So you can see how much less bone density there is, right? So what cells are responsible for osteoporosis? And this would be your osteoclasts, right? Because they're breaking down the bone. So osteoclasts can still be active, but your osteoblasts may not be as active. And so your osteoclasts are just outpacing your osteoblasts. So you're going to be taking away bone density instead of putting it in. Who's most at risk? And this is going to be the postmenopausal older women. Okay. I think that's all I have to talk about. Oh, it's some bone fracture stuff. So for bone fractures, I'm not going to have you guys memorize the different kinds of fractures. I just want you guys to take a look at the different kinds of fractures that are possible for bone. And they're named after their appearance, where they are located, and the nature of the break. Just one definition for you here. What's a closed versus an open fracture? Or sometimes you hear the word simple and compound fracture. And all that is if you break your bone but it doesn't stick out of your skin, it's a closed fracture. It's completely internal. But if it's an open fracture or compound, it does puncture through the skin. So we've seen sometimes we see athletes fall and they have an open fracture, and it's very, very disturbing. When your bones heal, they heal very quickly compared to, cartilage, for example. But it's a very quick healing tissue. And you're going to get a hematoma, which is a bruise. You're going to get a callus forming, and a callus is both bone and cartilage forming bridges that will traverse the break, right? So kind of knitting the break together. And then you're going to get an external callus. So externally, your bone is going to get bigger, and then internally, it's going to be a lot of sort of tissue. But this external callus, I think this is what the myth propels the myth that after you break a bone, the bone is actually stronger than before, and that has been disproven. So while healing, when you have that cuff or callus, right, this right here, yes, it is stronger. This is a little stronger than the rest of your bone because there's extra material as it's healing. But, so it's true that a few weeks into the healing process, the bone at the break is stronger. However, it eventually diminishes, and a few years later, you're left with a bone that might be as good as new, but no stronger or weaker than the equivalent bones nearby. So just a little tidbit for you. This last topic with gross anatomy of bone, I'm going to introduce the topics to you in Chapter 6 and Chapter 7 as we move through the bone. So this is something you can look at now. I'm not going to quiz you on it anytime soon. This is all the language of bone. So different features of bone have different names, and like I said, I'll introduce them later. All right, that's it for our Chapter 5.